Hello, greetings to everyone. My name is Pawan Sharma and I'm a pediatrician. Welcome to Child Health Matters. Let us talk about cough and cold medications for children. So, what is cough and why do we cough? Basically, it is a protective mechanism for our breathing pipes and the lungs. And it is a symptom and it is not a disease, so there is always some reason behind somebody having cough, like it could be just common cold, it could be allergy, it could be asthma or other chest infections. The problem we face when we have a cough, or our children face a problem, that when we have a cough it is irritating, we don't like it. Vomiting, so children can be sick because of the cough, which is much more common in children rather than in adults. And then if there is a continuous cough or it is ongoing cough, it can be exhaustive, it can cause pain in the muscles, as because the chest muscles are working harder than usual. As I already mentioned, what is the importance of cough? That it is a protective mechanism. So, what will happen if we do not have a cough? We can aspirate things. What I mean is the things can go inside the lung, but they will not be able to come out. It could be secretions. It could be even be a foreign body. Then, because there is a collection of secretions within the lungs, it cannot be cleared off. We are likely to get more infections. So we'll get more infections. And then because we get more infection, as well as there could be aspiration of things into the lungs can actually collapse and it will not be able to function as it is supposed to. What we say in day-to-day life, most of the children during their early childhood suffer from common infections, and one of that is common cold and cough. So runny nose, a bit of a cough, some chesty cough is not uncommon. And the more commonest reasons are the viral infections like common cold, asthma, hay fever, and sometimes the viral chest infections. So now let us come back to what we were going to talk about is the common cough medications. There are plenty and different types of cough medications you can see. Either it is prescribed or it is available over the counter in the pharmacy or even in the superstores. So the common medications, if you look at them, the contents will show that it is one of the antihistaminic or anti-allergy medicines like chlorpheniramine, cetirizine. Sometimes there is a medication called as a dextromethorphan. As you can see all of them on the screen. Now, there is no evidence that these are effective medications in terms of cough symptoms or cough problem, because the underlying problems remains the same. Unless it gets better, your cough will not improve. We all know that the medications, they have their side effects, and the same applies to the cough and cold medications. So you can be allergic to even anti-allergic medications. Or the other problem is most of the cough medications, they cause sedation, so that will make children very sleepy. So because they are sleepy, they will not eat enough, they may not drink enough, and then even their learning is affected because they take a cough medication and go to school, and they may not be where their fullest to perform in their educational activities. It does cause dryness of mouth. I'm sure you all have experienced that. And then, because if you're suppressing cough, there is a possibility that the underlying problem actually can get worse. And for the same reason, number one, the cough is a protective mechanism. We need it. Number two, if we do not have cough, we will have a problem. Number three, the medications are not scientifically proven to be very effective. So there is no indication to use cough and cold medication for children and even adults. Thank you so much for listening to this small talk, and it will be interesting to know what are your own thoughts about this. Thank you so much once again, and wishing you all the best.